Hi, my name is Dr. Erica Peraza with Liberty Rehabilitation Specialists, and this week our physical therapists are going to be discussing plantar fasciitis and things related to that topic. So, today specifically, I'll be discussing fascia anatomy, and I will end the week on Friday at 1 o'clock with an hour-long webinar about plantar fasciitis in the foot, where you will have the opportunity to ask me questions live. So keep an eye on our Facebook page for that. But today we'll talk about fascia, and that is a type of connective tissue found throughout the body that covers and separates underlying tissues and encloses our muscles. So it's made up of a fibrous connective tissue, and it contains closely packed bundles of collagen, and they're oriented in such a way that the fascia is flexible and resists tension forces. So if you think of a finger trap, I think that's one of the best analogies for fascia. You put your fingers in and you provide a tension force, but the finger trap is flexible and can resist that. No matter how hard you pull, right? Your fingers are stuck. So our fascia is kind of classified into different types based on its function and based on its location in the body. So we'll take a look at a picture that I have that I think really depicts well what the fascia is and how it's separated. So if we take a look at this picture, we see three different types of fascia. You have your superficial fascia, your deep fascia, and subserous fascia. So we'll start with superficial. That layer of fascia is between the skin and other underlying organs. And it's also known as the subcutaneous layer or hypodermis, so right under the dermis or the skin. So it gets its name because it's superficial. It's the most outward facing layer of fascia that we have. Then we have our deep fascia, and that is a more tough sort of fascia. It forms a strong fibrous internal framework, and it connects to capsules, tendons, and ligaments. So when we think about the plantar fascia, which we'll talk about for the rest of the week, and I'll end with a webinar on Friday, that's the kind of fascia that we're talking about, a deep, dense connective tissue. And then we have our subserous fascia. So that layer lies between the serous membrane and the deep fascia that we just discussed. So that's the most internal layer of fascia that we have, but that pretty much covers fascia in our body. It's found everywhere and covers and separates other underlying tissues and encloses our muscles. So those are the three different types of fascia layers that we have, classified by function and location in the body. And remember, when we talk about plantar fascia, the rest of the week and specifically on Friday for the webinar, we're talking about deep fascia, that deep, dense connective tissue. So if you have questions about what fascia is or how it functions, feel free to leave your questions in the comment or tune into our webinar on Friday and you can ask live at that time. We'll see you then. Bye.